Well, I was born in New Jersey, went to college in Pennsylvania at a small college called Franklin Marshall. Then went on back home to New Jersey to go to medical school through what is now back called Rutgers Medical School again. And then did my residency training in Philadelphia and at a hospital called Medical College of Pennsylvania, which is now part of the Drexel University system. And then after that, I finished and went into private practice, worked for a group in Southern Maryland, and then went out on my own there, where I practiced for a total of just about 25 years before coming over here to Virginia and coming to work for Fauquier. I think it's a beautiful area, a great community. I like the fact that we're right on the edge of Gainesville, and Manassas, where everything you want possibly could be there within a short distance, and then farmland and horseland and the mountains and all the outdoors activities you can do just on the other side of town. I live in Warrenton now, real close to the hospital, which has been great for me because doing obstetrics, it's nice to be close to the hospital. When I was in med school, you rotate through all the different specialties, and I actually kind of liked a little bit about a lot of different things. And one of the things I really liked about OBGYN was it had a lot of different things. There's the family practice side, and that we have women that we take care of for many years, from adolescents to their 80s and 90s. I've had patients and kind of do their regular year-round women care, as well as I liked surgery, but I didn't want to spend all of my day in the OR. But as OBGYN, we do surgery, and that's evolved so much through my career with the minimally invasive surgery, now doing laparoscopic surgery and the minimally invasive hysteroscopy and laparoscopy, and moving towards the robotic surgery going in the future. And it's always kind of something new. And then there's kind of the OB, which of course is the exciting part. It's almost like the emergency room, that you just never know what's going to happen in the next few minutes, and having to kind of think on your feet, which is fun. And then, of course, I get to be routinely in on the biggest event in most people's lives, so that's a pretty special honor. And one of the things I miss a little bit are my patients from Maryland, where I was for so long, because there were whole families that I would see. And I'm really blessed that a lot of them still actually make the trip to come see me here. And there's sisters and aunts and cousins and daughters and grandmothers and that I've seen through the years, and that's really cool. I like those relationships. That's kind of, like I said, the one challenge with starting over again was building new relationships, but that's one of the things that are especially wonderful. I talk about my role in obstetrical care of patients, that I feel like I'm their consultant, their expert, so to speak, that I'm their guide through pregnancy. I always say I treat pregnancy as a condition, not as a disease. I like my patients to be active and healthy. I'm here to help them guide through all the questions and all the information. There's so much information out there, some misinformation. Women, I didn't touch on earlier, but the reason I went into OBGYN is because women are much better patients than men are. They are much more informed, and they take care of themselves better. And so I really find it helpful that we can have an interaction, and I can help guide them through pregnancy and answer the questions for them as they go through. And having midwives in the practice especially, I think has been a really neat experience for me and helpful. I've learned from them. And I think that I have a kind of a low intervention philosophy as far as pregnancy goes. And like I said earlier, I'm here to help guide them through pregnancy, to look for problems if they pop up, and help deal with them if they pop up, but also to help them have the birth experience that they're hoping for as best as we can. And then again, we're having the midwives and working in collaboration with each other, that I'm there if the emergency does arise and we have the ability, if they have to have an emergency C-section, that we can do it, or if they have to have a C-section for another reason. And then we have the nursery and the pediatricians there who can also help take care of their baby in those situations.